COVID-19 is not airborne. COVID-19 transmits via droplets, and what we mean are these small little particles of moisture, liquid. These particles, when they come out of your mouth, they drop. And so that's why we say between 1 and 2 meters. Anything beyond that, they don't disperse. So no, it's not airborne. It's through close contact and through respiratory droplets. But the one thing I should say is that in healthcare facilities, we do tell healthcare workers that when they are treating patients, very sick patients, where they have to intubate them, and sometimes you have particles that could be dispersed much further than just that 1 to 2 meters. And so in those situations, we tell healthcare workers, you have to use airborne precautions. And so there may be some confusion out there when we say airborne precautions. Those are for healthcare workers performing very specific procedures, but for every day, no. And what they've learned from more than 70,000 cases in China is that very few people actually have runny nose or actually sneeze. Most people will have a fever. Most people will have a cough. What we do worry about is anyone that has shortness of breath or chest pain, to make sure that they seek health care very quickly. So I'm not aware of any evidence that this virus transmits between pets and people. There's a lot of investigations that are underway. They have not found this virus in an animal yet, in the zoonotic source of what we believe initially, that this outbreak began with people who were in contact with wild animals, not pets. But we have no evidence of this virus in pets, and no evidence of this virus transmitting between pets and people. I think you can use swimming pools just fine. Many swimming pools have chlorine in them, and we haven't heard of any transmission happening in swimming pools. So there are some studies that are ongoing right now that look at virus survival. We don't have the full results yet, but what we know from other coronaviruses like SARS and like MERS is that on packages, on certain like cardboard materials, that it doesn't last very long. What is important, though, on certain other surfaces like plastic, that the virus can be inactivated by disinfectants.
So if you want to know more about disinfectants and disinfecting your surfaces, go to the WHO site, go in and look at the guidance. You'll find it under coronavirus, and you'll find all that information there.
Just because you have a fever and a cough doesn't mean that you're infected with COVID-19. That's really important. It's also flu season. You know, so there's a lot of people around who have the sniffles, who have a cough, who have a fever. Talk to your colleague, express your concerns, talk to your employers, and just see how can you make sure that you continue to be able to work. And there's a lot of ways in which you can work from home, if that's possible with your type of job. Sounds very simple. It doesn't sound very exciting, but it is incredibly important that you make sure that you wash your hands with soap and water. And if you don't have soap and water, you can use an alcohol-based rub. The second thing that you can do is what we call respiratory etiquette. Sneeze or cough into your elbow, or you use a tissue, and then you throw that tissue away, and then you make sure you wash your hands. And the third thing that is really important is to educate yourself. So make sure that you have the latest information from WHO, from trusted sources. This is a rapidly changing situation, and so the more we learn, the more we want you to know about this. And by educating yourself, you can make sure that you protect yourself and you protect your family. WHO recommends that you wear a mask if you're sick. There's a lot of things that you can do to protect yourself while traveling, and that is making sure that you travel when you're well. You know, you're feeling well, you and your family. Making sure, again, you wash your hands a lot, you practice respiratory hygiene, making sure that when you eat food, you know, you're eating cooked food. And so just wearing a mask in general, no, but making sure that if you're having symptoms, respiratory symptoms, that you wear a mask.
And what happens if you're, say, coughing into your mask and it gets very wet at the front?
You need to replace your mask. If you don't touch the front, you take them off from the sides, discard them, wash your hands, and put another mask on.
And when you discard them, you would make sure that you discard them somewhere safe?
That's right, in a bin that is covered. Yes, that's right. I wouldn't even say asymptomatic, but pre-symptomatic, meaning it's a few days before they develop symptoms themselves. And so when you go back and you interview them, oftentimes they say, well, actually, I wasn't feeling very well. So it's this pre-symptomatic phase or mildly symptomatic phase. Having said that, it is possible, and we do have some case reports of truly asymptomatic people that can infect, but we don't believe that they play a major role in transmission. The important number of days has to do with what we call the incubation period, the time that you are infected to the time that you develop symptoms. We believe that most people will show symptoms 5 or 6 days after they are actually infected. What we look for is we look for case pairs. So if I'm a case and you are one of my contacts, then we follow you for a certain number of time to determine how long it takes for you to develop symptoms. So we are constantly looking at data that's coming from countries, and as of right now, we feel very confident that 14 days is the right upper bound. We are learning about what this virus can do in different countries. You know, there's a lot of cases in China, and there's some colder climates there. I was in Beijing recently, but I was also in Guangzhou, which is more southern part of the country, which was much warmer. And so you do see transmission. It's too early to say if temperature, in terms of outside temperature, has anything to do with virus circulation. But we need to prepare ourselves that this virus can transmit between people anywhere that it goes. There was a really big report that came out of China, I think it was last week, where it was looking at 55,000 cases. I think it was 2% of those infected were among children. And that's a very low number. And that's important to know, because in flu, for example, children are really important in transmitting this virus. But in COVID-19, they don't seem to be. We don't know why yet. And so that's a big point of research. But even the children who are infected, many of them will have mild disease. A majority of people who are infected with COVID-19 will have a mild disease, which may actually include a mild form of pneumonia. Antibiotics will not work against COVID-19 because that's a virus, but I know that you could have a co-infection with a bacteria, and an antibiotic may be helpful for that, but it won't actually work against a virus. Please come back to the WHO website and look at what we have posted. There's new postings every day, whether there are situation reports, which gives you an overview of the latest cases and what WHO is doing. There are myth busters. There are videos that can help you, teach you about, like I said, how to wash your hands, how to make sure you wear masks appropriately, and many other things. But please do continually, read about this and look at the websites and make sure you have the latest information at hand.